Healthcare. We had the best healthcare system in the history of the world. I'm old enough to remember what it was like as a young man in the 1950s and the early 60s. Health insurance was available to virtually everyone. Even if you had pre-existing conditions, you could still get health insurance. You might be exempted from those conditions for the first year or two, but you could still be covered for everything else and probably eventually even for the condition that you had before you got the health insurance. Doctors would know who you were. They didn't have to consult a file folder. They didn't have enormous staffs to handle all the paperwork. They knew who you were. They even made house calls if it were necessary. Hospitals. A hospital stay for a routine operation might cost 4 or 5 days' pay, not the several months' pay that it takes now. We had charity hospitals and free clinics in virtually every country, in virtually every city of the country. And now all of those hospitals, almost all of those hospitals and the clinics have been run out of business by government regulation. You know, that same government without whom the poor would be left helpless. Hospital stays now cost months of your pay. Doctors are so overburdened with paperwork from Medicare, Medicaid, health insurance companies having to adhere to mandates of the federal government that they have no time for you, and they have to have nurses interview you first, and they have these enormous staffs to take care of all this paperwork. And health insurance now has become so expensive because of all the mandates that the federal government and other state governments have loaded on the health insurance companies. You have to cover abortion, you have to cover mental illness, you have to cover drug abuse, you have to cover alcoholism, you have to cover all of these things, so that now health insurance is so expensive that 40 million Americans can't afford to have it. And of course, government is good at one thing. It knows how to break your legs and then hand you a crutch and say, see, if it weren't for the government, you couldn't walk. And so now that it has made such a mess of health care, they believe that only the politicians can fix it. How are they going to fix it? By getting the government out of health care? Of course not. By new government programs. Now they want to handle prescription drugs. After what they've done to Medicare, I can't imagine that they would have the nerve to do so. You know, today senior citizens pay more than twice as much out of their own pocket for health care as they did before Medicare began. Even after allowing for inflation, they have made life miserable for senior citizens. A senior citizen finds that 20% of the tests and treatments he needs is turned down by Medicare. And the law says he cannot pay the doctor directly for this when Medicare turns it down. It's against the law. The doctor could actually go to jail if he were to accept money from a Medicare patient. How are senior citizens better off? Now they want to extend this to prescription drug care. You can imagine the results will be that prescription drugs will become far more expensive for all of us, harder to get, and it will slow down the production of new drugs for Alzheimer's or cancer or other things that may be in the pipeline right now. The federal government has made a mess of everything that it has touched. It is not as though we gave up the Constitution for some benefit. We have not. It is not as though the money that you send to Washington with your income tax is producing some result. It is not. It is not as though the politicians have made America a better place with all these programs. They